Hi everyone, my name is Shikufe. We are honored to have the most caring doctor in Los Angeles with more than 20 years experience. Hi Dr. Naim.
Good morning, Shikufe. Good to see you.
Great to have you here, thank you. I have selected some questions from your social media.
Sure.
I'm going to ask you some of them. Thank you. What is the best way to treat period cramps?
Period cramp is one of the usual complaint of a lot of patients. It has different levels. Some people have little cramping, some have very severe pain during their cycles. Could be due to many reasons, such as polyp in the uterus, could be fibroid, could be endometriosis, that they all need different workup to be diagnosed. But many of them respond to birth control. So a lot of them, if you go on birth control, makes your cycle less painful, less bleeding, and that's usually the main treatment, be either pills or patch or ring or injection. Even IUD can help you with that. Of course, a lot of people don't want to take any hormone medication. We try to treat them with any NSAIDs such as Tylenol or Motrin that would help them. Occasionally, people might need some kind of procedure such as laparoscopy for severe pain such as severe endometriosis. But in general, most of the patients do respond to a low-dose birth control method.
All right. So we have a question here. Is it normal for one breast to be larger than other?
Interestingly, a lot of people do have this issue, especially younger women, that one breast is a little larger or less than the other one. It's very common. Not much can be done. There are certain treatments on market, such as suction, but they don't really work. If it doesn't bother somebody, to just leave it alone. Obviously, if there is a large, because of the tumor, or there could be some kind of cyst, then that has to be checked by ultrasound, maybe do a biopsy. But in general, if everything is negative and doesn't bother the patient, we can leave it alone. To treat it for somebody that has problem with this issue is usually putting a breast implant would be something that would treat it. Obviously, they use one implant that's bigger than the other one for the smaller breast, and then we have two normal size. But again, if somebody has this and it's not an issue for them, you should probably leave it alone. It's not a medical issue at this point.
Okay. What is genital wart and what are the symptoms?
Genital warts are caused by human papillomavirus, HPV, which is a very common virus. They did studies in certain, even college girls, up to 80% were positive. So it's a very common virus. Interesting is that the virus, there are like about 34 different types. The subtypes that can cause cervical cancer don't cause warts, and the ones that cause warts usually don't cause cancer. It's usually a very small growth on the vaginal area. Men can also have it on the genital area. It can be treated by medication such as Aldara that kind of burns the warts, or laser, or by freezing. A lot of time when you treat them, they don't come back. But there is no treatment for the virus itself. So sometimes the body gets rid of the HPV, but usually when you expose and have it, you will have it for a long time. There's of course vaccine for HPV virus right now is recommended for even younger girls as 12 before they get sexually active, which helps for the HPV. But it's only for 3 or 4 subtypes. So just because you have a virus does not mean that you won't get the virus itself, because there are different types that there is no vaccine for them, and you might still have the virus and end up with warts. But I will tell my patients, just because you have the virus, don't worry about it. If you have your regular checkup, your regular pap smear, it should not affect your life in anything serious.
So, what is HPV symptoms?
So, as I said, HPV is very common, and interestingly, there is no symptoms. A lot of people do carry the virus and don't have any symptom. As I mentioned earlier, we do pap smear with HPV test, and a lot of patients come positive, have no symptoms, and if it doesn't bother them, we will leave it alone. Interestingly, even cervical cancer has no symptoms. A lot of people can have cervical cancer. That's why you have to have your pap smear done regularly, because you might have a cancer and not know. But if you have the Pap smear, you will know before it gets to any cancer stage, so you can see for precancerous cells. Occasionally people might have irritation or discharge, but most people don't have any symptoms of having HPV, which is a sexually transmitted virus.
How soon after a miscarriage can you try to conceive?
Miscarriage is a very common problem for the patients who get pregnant. It's been shown that even up to like 30% of pregnancies end up in early miscarriages. Often patients don't even know, within like 2 or 3 weeks they end up losing the pregnancy. Some patients have recurrent miscarriage, like 2 or 3 miscarriages. In general, after 1 miscarriage, we don't recommend a major workup. Even after 2, sometimes after 3 miscarriages, they recommend to have a workup done to see what is the reason. A workup could be a genetic study for both partners, could be an ultrasound, could be looking for a polyp or anomaly in the uterus. But most of miscarriages are caused because of anomaly of the fetus, and that's why the body rejects it. But it's very common. Just because you have a miscarriage doesn't mean that you have a problem getting pregnant later. We recommend usually wait at least 1 or 2 cycles before trying to conceive again. So we tell them not to get pregnant because you could have a higher risk of miscarriage if you get pregnant right away. So within like 2 cycles should be time enough to try again to get pregnant.
Okay, I have a last question. Sure. What can be done to increase the success of IVF after embryo transfer?
So after embryo transfer or after any pregnancies, depending on the risk factor, there might be certain treatment that a patient might receive. Sometimes patients receive progesterone after getting pregnant. The progesterone supports the uterine lining better and might be helpful in decreasing miscarriage, usually up to 12 weeks. Sometimes patients have bleeding while they're pregnant, also might get progesterone that would help them. Also, progesterone shown to decrease risk of preterm delivery. So I have patients who might be on progesterone up to certain weeks, depending on the risk factor. The other medicine that might be helpful is aspirin. A lot of patients receive baby aspirin, especially IVF patient or patient with miscarriage. Aspirin is kind of a blood thinner, has been shown to decrease blood clot to the placenta and decrease risk of miscarriage. So these 2 are the main things. Occasionally, depending on the workup of patients, there are certain diseases that can cause also miscarriage. They might need to be on more major blood thinner, such as heparin injection. And there's patients who might need injection blood thinner while they're pregnant.
Thank you, Dr. Naim, and thank you for watching us. Please leave your comment in direct message. We're gonna come back with your answer.
Thank you, Shakufa. Always good to see you.
Thank you.